Well, I wanted to ask you then, that kind of brings me to another question I had, which was regarding the greatest challenges you face as a dermatologist and then the main rewards of the profession. So why don't we start with challenges? I mean, feel free to tell me a little bit about that.
Every day is a challenge, right? Every day you meet a new challenge, but fortunately, I'm able to rise to the occasion. Many times I ponder or reflect upon my training in New York City, right? I trained at the New York Medical College Department of Dermatology. We were based out of Manhattan, and I had about 9 months of normal, quote, normal training before the pandemic happened in New York City. So
Oh,
I very
wow.
much was in the belly of the beast and on the front lines. And so, with that being said, I probably have seen it all in that aspect, or nearly seen it all, or at least I think I've seen it all from the pandemic, right? And so that very much molded me into becoming someone very brave, courageous, with quote thick skin. And I very much have seen emergencies while out on, the parking lot special pathogens unit that I had to work at many shifts from people literally dropping dead who are, anoxic, who are, satting at 38% oxygen. So to have to go from like dermatology clinic to that was quite a shift, but that was one major challenge that then made me strong enough and bold enough to be able to take on many challenges that I see today in dermatology clinic. With my boots on the ground, I'm seeing anywhere from, let's say, the high 60s to low 80s per day. I work
Wow.
4 days a week. So, challenges that I see nowadays would be challenging cases. I'm only one of a handful of board certified dermatologists in the whole Commonwealth of Virginia to see Medicaid. So, lower income individuals, those who are completely uninsured, those who are underinsured, who have, an inequity in access to care, dermatological care. And so I find that the trend is that these patients many times present with advanced or very severe skin diseases, whether that be a more advanced type of skin cancer in from folks who are coming in from Appalachia or rural Virginia, or in patients of color who present with, let's say, very advanced hidradenitis suppurativa or very advanced forms of scarring hair loss. And it is a challenge, it is a mystery, both in terms of dermatology, doing biopsies, getting the history, but also encouraging compliance. A lot of times, these individuals traditionally have had more difficulty with accessing care, with compliance with treatments. And so I really spend a good amount of time educating these patients about compliance, about following up in clinic. And so there are individuals who, for better or for worse, may not follow up every time, who are of the Medicaid, insured individuals, perhaps those of a lower socioeconomic status. But I tell myself that if I don't do it, who else will? And so these challenges are certainly present daily, but I'm able to and very proud of rising to the occasion of helping these individuals because genuinely, who else will?
That's excellent. That's excellent to hear. Yeah. Well, okay, so let's dive in a little bit more to this too, because I'd love to hear a little bit about your special clinical interests and any kind of big advances in that area that you've noticed since you began your practice.
Certainly. I did a lot of training in skin of color. I always, because of my fellowship training in terms of research fellowship training, being in skin of color, hair loss disorders, hidradenitis. So I do tend to focus more on skin of color in general. But certainly within that category and within all of dermatology, I should say, the allopathic conditions, hidradenitis suppurativa, in more complex cases of psoriasis are areas that I certainly love to, and I look forward to, spending more time on, seeing, treating. Mainly because, let's just say, allopathic conditions or alopecia is just a category in dermatology within which we have a multitude of various allopathic conditions. they're very traumatizing, right? If you suddenly have scalp pain, burning, itching, you're embarrassed, you feel ostracized, you lose your hair, you undergo hair thinning, all these things can really affect one's self-esteem. And I've seen advances in oral therapies that were a little bit more of pushing the envelope when I first came out of residency that are slowly becoming more mainstream now. And that's something that I find to be really exciting, from your oral minoxidils to your various methods of prescribing oral dutasteride to bicalutamide, and then procedures that are gaining more popularity and research, evidence-based medicine, things like low-level laser therapy, platelet-rich plasma, platelet-rich fibrin, microneedling to a certain extent into the scalp to help with allopathic disorders are things that I'm learning as I'm going, or that I learned from residency that I adopted in practice, or that have advanced while I'm in practice, and that's very exciting. I tend to lean towards women of color, men of color with hair loss disorders, CCCA. I'm very proud to say that I made the front cover of the Journal of Drugs and Dermatology for biopsies in the work that I've done with Dr. Valerie Callender.
Oh,
I
wow.
made the front cover of that. I can't remember which edition, but it was when I was in residency for our work, and basically demonstrating CCCA under the microscope dermatopathologically, correlating that with disease severity, et cetera, the fibrosis that we see. That's a condition that I tend to love to treat and love to see. And for various reasons, people are just confused about CCCA. They are just told you, oh, you just have alopecia, but what kind, where, what can we do if, and again, I'm part of like the Strand network. Strand is a network led by Dr. Chisana Kindred, who is an awesome friend and mentor as well. And I've been speaking at those platforms with other leaders, not only in skin of color, but also in hair loss, and I'm very proud of that. So I tend to gain information from the research that not only I do when I present, but when listening to my colleagues present, and just the sharing of great ideas between great minds and bringing that into practice. As for hidradenitis, from the time that I've graduated and started practicing, there have been two new biologic drugs, Cosentyx and Bimzelx, that have been added to the armamentarium that we so desperately need in the management of hidradenitis, a terribly devastating, chronic, relapsing wound, basically,
Right.
condition that we see, unfortunately, disproportionately affecting people of color. And it's very exciting to hear about future advances. The whole Jackstat oral pill realm is a really exciting and up and coming area of dermatology and dermatopharmacology. And there are certain medications in that category that are coming out as an oral pill option for hidradenitis, hopefully sooner than later, because we need it so desperately. And I'm really excited to get my hands on that to be on label to use it.